Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very interesting topic, the clinical anatomy and the unique innervation of the sternocleidomastoid muscles, cranial nerves part 67 and spinal accessory nerve, that is the 11th cranial nerve part 1. The clinical anatomy and the unique innervation of the sternocleidomastoid muscle. First, let's talk about the clinical anatomy of the 11th nerve and then the unique innervation of the sternocleidomastoid muscle. The spinal accessory nerve, cranial nerve 11, is actually two nerves that run together in a common bundle for a short distance. The major part of the 11th nerve is the spinal portion. Its function is to innervate the sternocleidomastoid muscle and trapezius muscle. When the actions of the sternocleidomastoid muscle and trapezius, when one sternocleidomastoid muscle contracts, the face turns in the opposite direction. When both the sternocleidomastoid muscles act together, the two muscles flex the neck. The trapezius, it elevates, retracts and rotates the scapula and assists in abducting the arm above horizontal. The sternocleidomastoid and the trapezius muscles act together to rotate the head from side to side and to flex the sternocleidomastoid muscle and extend the neck, the trapezius muscle. Conjugate deviation of the head. The neurons of the spinal portion of the 11th nerve communicate with the 3rd nerve, 4th nerve, 6th nerve and 8th nerves through the medial longitudinal fasciculus. These connections are important in controlling conjugate deviation of the head and eyes in response to auditory, vestibular and other stimuli. When someone makes noise, we turn the head and eyes towards the side of the stimulus. So what is the mechanism? The 11th nerve, sternocleidomastoid muscle, it is connected to the 3rd, 4th and 6th nerve, that is the extraocular muscles, and 8th nerve, vestibular nerve, which helps in the response or the turning the head to the side of the stimulus, be it auditory, vestibular and other stimuli. So these connections are important in controlling the conjugate deviation of the head and eyes in response to auditory, vestibular and other stimuli. Now let's see the very fascinating concept, the cortical innervation of the sternocleidomastoid muscle. All the cranial nerve nuclei are bilaterally innervated but predominantly contralaterally innervated. But sternocleidomastoid is an exception and it is unique because the sternocleidomastoid muscle gets a predominant ipsilateral supply. So very interesting and very unique, very important. Both the sternocleidomastoid muscles and trapezius receive bilateral supranuclear innervation. However, the input to the sternocleidomastoid muscle is predominantly ipsilateral and that to the trapezius muscles is predominantly contralateral. So the sternocleidomastoid muscle turns the head to the opposite side and supranuclear innervation is ipsilateral. Therefore, the right cerebral hemisphere turns the head to the left side. So very interesting, if there is a stimulus on the left side and you want the head and the eyes to turn, the right frontal cortex gets stimulated but it predominantly innervates the sternocleidomastoid on the same side ipsilaterally. So when the sternocleidomastoid muscle contracts, the head turns to the opposite side. Likewise, frontal eye fields area number 8, when it gets stimulated, it pushes the eyes to the opposite side, known as saccadic movement. So when the right frontal cortex is stimulated, the eyes moves to the left side, the head also moves to the left side because of the contraction of the sternocleidomastoid muscle. The sternocleidomastoid muscle turns the head to the opposite side and its supranuclear innervation is ipsilateral. Therefore, the right cerebral hemisphere turns the head to the left side. So these are all the fascinating concepts of the 11th cranial nerve and especially the unique ipsilateral innervation of the sternocleidomastoid muscle. I hope you have enjoyed listening to these concepts. The other important concepts of neurology, I have put it in a book called Focused Neurology, where I put it in a question and answer format. This book is available all over the world online from all leading booksellers including Amazon. If you are interested, this book could be purchased online. I hope you have enjoyed listening to my concepts of sternocleidomastoid muscle and its unique ipsilateral innervation. If you have liked it, please share the link, put a like symbol, and then subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.